Here is detailed information about Fondaparinux, Arixtra, covering all key aspects for clinical, academic, or pharmacological use. 1. Generic name, drug class, drug forms, brand name. Generic name, Fondaparinux sodium. Drug class pharmacologic, selective factor XA inhibitor. Therapeutic, anticoagulant, antithrombotic agent. Drug forms, solution for subcutaneous SC injection, available in 2.5 milligrams per 0.5 milliliters, 5 milligrams per 0.4 milliliter, 7.5 milligrams per 0.6 milliliter, 10 milligrams per 0.8 milliliter. Brand name. 2. Definition. Fondaparinux is a synthetic pentasaccharide anticoagulant that selectively inhibits factor XA, an essential component in the coagulation cascade. It is used primarily to prevent and treat venous thromboembolic events, VTE, including deep vein thrombosis, DVT, and pulmonary embolism, PE, especially after orthopedic or abdominal surgeries. 3. Mechanism of action. Fondaparinux binds specifically to antithrombin 3, A3, causing a conformational change that greatly enhances AT3's ability to inhibit factor XA. By inhibiting factor XA, Fondaparinux prevents the conversion of prothrombin to thrombin, thereby blocking the formation of fibrin clots. It does not inhibit thrombin, factor 2A, and has no effect on platelets. This makes it more selective than low molecular weight heparin, LMWH. Pro4. Indications FDA-approved uses, prophylaxis of DVT in patients undergoing hip fracture surgery, hip replacement surgery, knee replacement surgery, abdominal surgery with risk of thromboembolic complications, treatment of acute DVT, acute PE used in conjunction with warfarin, off-label treatment of heparin-induced thrombocytopenia, IT, Nash 5. Contraindications. Fondaparinux should not be used in the following situations: active major bleeding, severe renal impairment, creatinine clearance 30 milliliters per min, body weight 50 kilograms in patients receiving it for prophylaxis after surgery, bacterial endocarditis, known hypersensitivity to Fondaparinux or any of its components. 6. Precautions. Before taking this medicine, discuss with your healthcare provider if you have kidney disease, monitor creatinine clearance, low body weight, 50 kilogram increases bleeding risk, history of bleeding disorders, ulcers or recent bleeding events, recent spinal procedures or epidural anesthesia, risk of spinal hematoma, concurrent use of NSAIDs or antiplatelets, elderly age, increased bleeding risk, pregnancy or breastfeeding, category B, no adequate studies in pregnant women, use only if clearly needed. 7. How to use Fondaparinux. Subcutaneous injection only, never intramuscular or intravenous, injection site, anterolateral or posterolateral abdominal wall, alternate sides daily. Steps. 1. Wash hands and clean injection site with alcohol swab. 2. Remove needle cap from prefilled syringe. 3. Pinch the skin and insert the needle at a 45 degrees to 90 degrees angle. 4. Inject the solution slowly. 5. Do not rub the injection site. Dosing information A. DVT prophylaxis after surgery, 2.5 milligrams SC once daily. First dose 6 to 8 hours post-surgery if hemostasis is established. Continue for 5 to 9 days or until patient is ambulatory. B. Treatment of DVT PE with warfarin, 250 kilograms, 5 milligrams SC once daily. 50 to 100 kilograms, 7.5 milligram SC once daily, 10 milligram SC once daily. Continue for at least 5 days and until INR is 2.3.0 for 24 hours. 9. Misdose overdose. Misdose. Take the dose as soon as remembered. If it's almost time for the next dose, skip the misdose. Do not double dose. Overdose. Signs: uncontrolled bleeding, low BP, dizziness, bruising, no specific antidote. Manage with supportive care, possibly fresh frozen plasma, FFP, or prothrombin complex concentrates, PCCs. Stop or avoid taking if signs of serious bleeding, black, tarry stools, coughing blood, vomiting blood, allergic reactions, swelling, hives, difficulty breathing. You are scheduled for surgery or spinal anesthesia. Discontinue beforehand as advised. Sudden drop in hemoglobin or platelet count. Mach 11. Side effects: common siving, mild bleeding, nosebleeds, gum bleeding, injection site reactions, redness, pain, swelling, nausea, fever. Serious side effects: major bleeding, GI bleeding, intracranial hemorrhage, thrombocytopenia, monitor CBC, anemia, spinal epidural hematoma, may cause long-term or permanent paralysis, especially in patients receiving spinal puncture or epidural anesthesia. Hypersensitivity reactions, anaphylaxis, rare. Vital information, no reversal agent. Monitor closely for signs of bleeding. Avoid in patients with severe kidney dysfunction. Do not use intramuscularly. Monitor renal function, platelet counts, and hemoglobin. Do not use with aspirin, clopidogrel, NSAIDs, or other anticoagulants unless prescribed. 13. Drug interactions. Increased bleeding risk when combined with AG, ibuprofen, naproxen, aspirin, and other salicylates, antiplatelets, e.g. clopidogrel, prasugrel, ticagrelor. Other anticoagulants, e.g. warfarin, heparin, DOACs like apixaban, rivaroxaban, SSRIs, SNRIs, e.g. fluoxetine, sertraline, duloxetine. Other considerations, avoid concurrent use with thrombolytics, e.g. alteplase. Drugs affecting renal function. Thank you. Have a nice day.